one real debate in today's era that MIGS should be done nasally or temporally. So after aqueous angiography, this gives the best answer that where to put minimally invasive glaucoma surgeries. So coming to principle, it's a real-time aqueous humor outflow mechanism which uses confocal scanning laser ophthalmoscopy using spectralis mechanism with flex camera. So aqueous angiography can be done with two dyes. One is 0.5% endocyanin green dye, or you can reduce the concentration also, but we tried most of the 0.1% endocyanin green, so there is no decrease in quality of the image also. And then 2% fluorescein angiography can be done with very good image quality also, but with fluorescein there are some side effects like severe staining and toxicity of the corneal endothelium and epithelium, severe staining of the capsule and vitreous. With endocyanin green there are minimal side effects like staining of the corneal epithelium and endothelium, and there is staining of the trabecular meshwork, posterior trabecular meshwork. So dye preparation in RO green, there is the solvent given by the company. You just has to inject in the solvent.
Excuse me, Anand, what is your topic?
Actually, outcomes in moderate to severe glaucoma, but little bit
of bang.
Of bang.
Yeah.
So I am further going forward. So I will come out. So it's actually there is slight change in title also. So I used aqueous angiography a bit to explain a procedure little higher level. So after this the flex camera, flex positive we use for capturing after goniectomy to see where the channels are and where to use minimally invasive glaucoma surgery. And after injecting the dye, you have to focus the camera at the depth of 23 to 30 diopters of depth using 30 or 55 degree anterior chamber lens, and then tight anterior chamber maintenance is very important. So this is the one small surgical clip showing after injecting the endocyanin green dye. So we notify that aqueous channels are dense network of aqueous channels are more in the nasal quadrant, and then superior, inferior quadrant, and minimal at the temporal quadrant. So there is segmental aqueous outflow is noted. That is actually maximum in the nasal quadrant and little to very low at the temporal quadrant. So this is the one paper we published at British Medical Journal, that actionated outflow is noted after goniectomy in the high maximal aqueous outflow area. With minimal tissue damage and enhances the IOP lowering efficacy. So this is the one of the patient of primary open angle glaucoma with advanced glaucomatous optic neuropathy. So we did initially aqueous angiography with endocyanin green. So then we noted maximum channels at the nasal quadrant, and then superior and inferior quadrant, and nil channels at the temporal quadrant. And then we performed minimally invasive glaucoma surgery in this advanced patient, advanced glaucomatous optic neuropathy patient in the low flow area, that is temporal quadrant. And after that MIGS surgery, see here bang is performed. 1 minute. Video is stuck. So I'm going to next one. Next slide, please. Can I restart? Second one. So here we performed goniectomy in the temporal quadrant, and later there is, at the goniectomy area, two new aqueous outflow channels are opened up in this advanced glaucoma patient. So performing temporal versus according to surgeon's convenience, we usually do minimally invasive glaucoma surgeries at nasal quadrant in view of surgeon's access. But temporally doing these surgeries are greater efficacy with greater lowering of intraocular pressure. So this is the one aqueous angiography performed in IMSC, only cataract patient, no glaucoma. So there is 360-degree high flow of aqueous is noted. Aqueous outflow channels are noted. And then this is one normal tension glaucoma patient with around IOP of 12 to 14 mm of Hg. The 360-degree dense network of aqueous channels are noted in all these patients. So NTG explains that actually aqueous outflow obstruction is not there in the NTG patients. And then it's again stuck.
ऑडियो विजुअल बार बार क्यों हो रहा है ये?
So this is the one primary angle closure glaucoma with advanced glaucomatous optic neuropathy after ICG angiography. So no aqueous channels are noted at from around 1 to 2 minutes difference time. And see, you can, after injection of the dye, there are no aqueous channels noted at prominent maximum time also. So there are post-operative observations that in any moderate to severe glaucoma patients, you can do minimally invasive glaucoma surgery, but aqueous angiography gives ideal tool that where to put minimally invasive stents or do goniectomy also. So these are the some post-operative observations that with fluorescein dye, there are severe staining of the corneal epithelium and endothelium and lens capsule staining. On ICG staining, there will be staining of the trabecular meshwork and anterior chamber angle structures. So with there will be haze, media haze also while performing surgery. So better to avoid fluorescein dye and use indocyanine green dye with lower concentrations. Thank you.